Hi everyone, I am Dr. Anu and today we are going to discuss a very important topic, that is a hepatitis B vaccination. This is equally important for both pediatric residents and also for students who are preparing for their NEET exam because it is a part of the National Immunization Schedule. If you find this content useful, please give a like and also follow my channel for more such educational videos on pediatric related topics. So let's get started. So hepatitis B vaccine. So you know that hepatitis B vaccine is a part of the National Immunization Schedule and it is also an equally important vaccine for all the healthcare professionals. So let us see why it is important, how it has to be given, what is the dose and the schedule of this vaccination. So, the risk of infection in a child born to a hepatitis B positive mother will range from 10 to 85% depending on the mother's HBeAg status. So, based on the mother's status of HBeAg depends on how much the child will get affected. And HBV is the most common cause of chronic hepatitis, cirrhosis, and liver hepatocellular carcinoma. Outcomes are prevented by early childhood immunization. So coming to hepatitis B vaccine, this is a recombinant vaccine with the aluminum salt as its adjuvant and the preservative is thiomycin. This is a freeze-sensitive vaccine, so hence it has to be stored in a temperature of 2 to 8 degrees Celsius. It can be available in both monovalent and as combination forms. So the dosage is in children, that is age less than 18 years, the dose is 0.5 ml or 10 microgram, and age more than 18 years, it is 1 ml or 20 microgram. This has to be administered as intramuscular injection in the anterolateral thigh or the deltoid. You have to note that if the hepatitis B vaccine is injected in the gluteal region, the vaccine is considered invalid and the child has to be revaccinated. So coming to the immunization schedule, so we have two schedules. One is the regular schedule and the one is the part of the National Immunization Program. So the classical schedule is 0, 1 and 6 months. So the first dose has to be taken 0. Then after 4 weeks minimum interval, the second dose can be given. And then after minimum interval of 5 months, the 6th month vaccine can be given, which is 0, 1 and 6, the classical dose of hepatitis B immunization schedule after the childhood vaccines. Immunocompromised or chronic renal failure, you know that the response to the hepatitis B vaccine will be poor because they are immunosuppressed. So in that case, you have to give a double dose of hepatitis B vaccine and also give 4 times. So 0, 1, 2 and 12 months, and the dose has to be double. So if it is a child less than 18 years, if you are giving 10 microgram in a regular child, you have to give 20 in this place. In national immunization, we have the birth dose which has to be given as soon as possible, and in the IAP bar, the national immunization schedule, the remaining weeks is 6, 10, 14 weeks as combination vaccines with your pentavalent or your hexacin. So antibody titers more than 10 international units is protective. So coming to adverse reaction, this is a considerably safe vaccine even in the newborns. So reactions include pain, erythema and fever. The common contraindication for this vaccine, the only contraindication is severe anaphylaxis. Pregnancy and lactation is not a contraindication for hepatitis B vaccination. So coming to hepatitis B immunoglobulin. So hepatitis B immunoglobulin, it provides passive immunity to hepatitis B virus. So the dose is 0.06 ml per kg in adults or an absolute dose of 0.5 ml in newborns. So if a baby is born to a mother who is HBsAg positive, that is hepatitis positive, then the baby can be given 0.5 ml of hepatitis B immunoglobulin at the time of birth. So it gives a protection for nearly 3 to 6 months and the storage is 2 to 8 degree. So the indications include perinatal occupational sexual exposure to hepatitis B and in immunocompromised. Post-vaccination testing, So usually after receiving hepatitis B, we don't test if the child or the patient has mounted a antibody response. But in certain scenarios, we are supposed to check the titers. So the scenarios include patients who are on hemodialysis, those who have HIV, those who are immunocompromised, those who are in occupational risk, sexual partners of the HBsAg positive people, and also to infants born to HBsAg positive mother. So we all would have encountered that after we join a course, they mostly ask for a anti-HBs titer. This is just to see whether the hepatitis B vaccination that we have received is adequately protecting us from the occupational exposures. Also, if an infant is born to HBsAg positive mother, then the baby will get hepatitis B and hepatitis immunoglobulin at the time of birth and after 9 months, because we know that the protection will last from 3 to 6 months. After 9 months, we will check the anti-HBs titer to see whether the vaccine is protecting the baby. So, who are non-responders? So, a vaccine recipient who does not develop a serum anti-HBs response, that is an anti-HBs more than 10 milli-international units, after 2 series of 3 doses of hepatitis B vaccine each administered properly as per the schedule. So administer 2 doses of HBIG for these patients 1 month apart after exposure to hepatitis B. So if a non-responder, that is a person who has received 2 schedules of hepatitis B as per the guidelines, they have received the vaccine and still they have not mounted an anti-HBs titer of more than 10, you label them as non-responders. And if such a patient, if such a person who is a known non-responder has encountered a hepatitis B prick, needle prick or blood transfusion or somehow has come in contact with hepatitis B, we are supposed to protect them with immunoglobulin 2 doses 1 month apart. So coming to the management of infant born to a hepatitis B positive mother, so we know that perinatal transmission risk is up to 90%. So mother, if they are HBsAg positive, you administer both the HBIG and hepatitis B vaccine within 12 hours of birth using 2 separate syringes in 2 different sites at the same within 12 hours. If HBIG is not available, then hepatitis B vaccine at 0, 1 and 2 months with additional dose at 9 to 12 months we have to give. So this is a recommendation for administering the hepatitis B vaccine and the immunoglobulin for infants born to hepatitis B positive mother. The efficacy of prophylaxis with both this thing is 85 to 95% protection. That is, if a baby is born to hepatitis B positive mother and has been given both at the time of birth, there's 95% chance that the baby will not get hepatitis B. And with hepatitis B vaccine alone is 70 to 75%. So we have to check anti-HBs titer as I told you at 9 months of age. So this is some of the basic information regarding the hepatitis B vaccine, and I'll be putting a new video on the post-exposure prophylaxis of hepatitis B. So follow my channel and keep updating, keep watching. Click on the bell icon to get regular updates on the videos that I post in my channel. So thank you for watching the video fully. If you have any doubts, you can mention it in the comment section. And also if you want more topics in pediatrics, you can mention that also in the comment section. And please give a like if you find this video useful. Thank you for watching.